So I have a viewer who's curious about when should a woman consider getting her eggs frozen? That's a good question.
Very good question. So again, that's depends on each patient. You cannot give a specific age, Olga, as to you have to do it at age 33, 34, 35, 36. I guess that each patient has their own concepts, and you have to how do you say, proceed accordingly. I would say that to freeze your eggs in general are, at least in our practice, are women who are facing the possibility, the worst scenario of treatment for cancer. And before they begin the process of treatment, most of the time is either a combination or single chemotherapy or radiation therapy. That would be an important indication to freeze your eggs, and we do that. And nowadays, as part of our oncofertility practice, so that's important to keep in mind. The second thing is that if you are single and you don't have an immediate prospect of having a lifelong partner, then I think that freezing your eggs socially, it is now very much accepted in society, and I think that's also an important thing. And in general, even if you were to have a partner, married, and you wanted to delay fertility, and you are already, as I said, this quote unquote age of 35, 36, and your numbers are beginning to get worse, your ovarian reserve numbers, that is a sign that it is not a good idea to continue waiting, because as you wait longer, the scenario then becomes worse.
Okay, doctor, I'm going to switch gears for the purposes of time because I have several questions I want to get to for our viewers. And I want to talk about how the pandemic has affected some couples' desire to have a child, if you will. So let's watch this Coping with COVID segment, and we'll talk about it right after. Take a look.
When the pandemic-related lockdowns and stay-at-home orders began, many predicted a minor baby boom might result. But in fact, the numbers are showing a much different and more worrisome trend. According to studies, there will be 300,000 fewer babies born in 2021. There were far fewer unplanned pregnancies and less pregnancy-related Google searches. A recent fertility survey found that nearly half of couples plan to delay their timeline for having a baby. 26% were not sure about their fertility timeline, but 25% of people did say they were speeding up their fertility timeline because of a renewed emphasis on what's important in life. Researchers say the so-called baby bust could have wide-ranging negative effects on the economy and society for years to come.
So much to unpack there, doctor, but I just wanted to ask your thoughts on, did the lockdown take a toll on couples? And have you noticed that fewer people are wanting to get pregnant?
Yeah, that's true. To a certain extent, it is true. And I think that is because a little bit of misinformation, due to the fact that nobody knew how long this pandemic is going to last, and what are the impact not only on pregnancy, but as well as on the baby, on the neonate. So I have to say that at this point in time, from my reading and from being on top of this, there is clear-cut evidence that administering the vaccine for women who are pregnant, especially the Pfizer vaccine, gives 99% protection for the offspring, for the baby, because of the 2 doses. And in the Moderna type of vaccine, the protection is 44%. But of course, it will increase as we gain herd immunity later on. But this is something that is important for the public and for women, for the viewers of your program, Olga, to know that there is no evidence of transmission to the baby. And moreover, if the patient is vaccinated, as I just said before, there is a significant amount of protection in terms of antibodies to prevent any problems in the baby.
So to clarify, doctor, if you had a patient that was 3 months pregnant or 6 months pregnant or even 8 months pregnant, I'm trying to cover the whole gamut, you would recommend that they do get the COVID vaccine. Yes?
That's correct. Yes. According to the medical literature available at this point, until today, that I am, that I read it pretty frequently, there is no evidence of what's called in our field in medicine, vertical transmission, which means that it goes from the mother to the baby. With the vaccine, you are covering 99% of the antibodies that are developed in the baby.
Doctor, I only have a couple minutes left, but I want to get these two questions in. Would you say the same thing for families who are undergoing fertility treatments as well to get the COVID vaccine?
Absolutely. The same thing for couples, not for couples who are undergoing fertility treatment or fertility evaluation.